Hello, my name is Rashad Massoud, and I'd like to welcome you to this session that is dedicated to the work of the United States Agency for International Development's work in improving healthcare globally. I am the director of the USAID Healthcare Improvement Project, as well as its successor, the USAID Applying Science to Strengthen and Improve Systems project. I'm joined here by my colleagues, and if I would ask them to introduce themselves.
Tamar, Chitasvili. I'm implementing a healthcare improvement project in Georgia.
And I'm Humphrey, Megere. I'm implementing improvement work in Uganda under ASSIST project.
I'm Nigel Livesley. I'm the Regional Director for East Africa, based in Malawi.
Thank you, and welcome. Before we start discussing our program specifically, I'd like to give a little bit of an overview of the USAID improvement work through its global program. You've noticed that I mentioned two projects, the Healthcare Improvement Project and the ASSIST project. This year happens to be a special year when the two projects are overlapping, and that is because one of them is coming to an end and the next one is starting up. And in this 5-year cycle that happens every time, USAID redesigns its work to meet the evolving needs of improvement in developing countries. In particular, there have been some very significant changes in the newly awarded ASSIST project. For example, a major emphasis in the ASSIST project is on trying not to just produce better outcomes of care and to scale them up, but also to develop the capability within the country, the host country government that we're working with, to be able to improve care independent of foreign assistance in the future. The word we use is institutionalization. It hardly describes it, but it's really about cultivating the culture of improvement within the host country government institutions that we are working with. It is something that has been shown to work. We see islands of excellence in different places. However, it's by no means something that is the standard. And what we would like to see happen over the next 5 years is to make significant headway into being able to not only produce the good results that we see, but also develop that capability. Another major difference in the new ASSIST project is the heavy emphasis on managing knowledge for improvement. That is, we found over time that there's a lot of knowledge, a lot of experience that is generated through this work. This knowledge and experience remains very much localized, that is, within the group that's working on that. We've seen much less transfer of that knowledge in spite of making it available on websites and in some documents, which is really much less than what we'd like to see happen in real life. This has led us to pursue deliberately trying to understand how can we make this knowledge transfer, diffusion, the management of that knowledge in such a way that it reaches everybody that needs to and can benefit from using this knowledge. This has become a major area of emphasis for the ASSIST project, and we have really embarked on a very significant journey to do that. A lot of it lies in the idea that knowledge is generated in the moment through human interaction. That's distinctly different from information, the explicit sort of information that one sees on paper. Knowledge is very much personalized, contextualized, And people share it when they are probed and when there is an in-depth conversation happening. Now, what we'd like to do is create the environment for those conversations, and that's something that we have embarked on either through individual conversations or group conversations, or even in larger meetings, how we convene the larger meetings to generate that knowledge. Then, of course, capturing it, harvesting it in ways that make it be transferable not just within the very same contexts, but also generalizable to contexts that are different by understanding the principles behind it. And then making that type of knowledge and information more widely available. We're very excited about these two particular directions. I think they will contribute to the world of improvement in a very significant way going forward. And this is where we see much of our emphasis going into the newly awarded ASSIST project. What we'd like to do is to talk about some of our programs and some of the work that we have. Let me start by asking Humphrey. Humphrey is our Chief of Party for one of our largest projects in Africa. Humphrey, could you tell us something about the work that you are doing in Uganda?
Thank you very much, Rashad. In Uganda, under the USAID ASSIST project, we are working with the Ministry of Health to institutionalize quality improvement in the health sector. We are working with the US government-supported partners to incorporate improvement work in their work plans and the activities that they are doing. And we're also working with hospitals and health centers to have improvement work done at that level. We have a number of technical areas that we are supporting. These include HIV care, which is our biggest project. And we look at the whole continuum of HIV care, from HIV counseling and testing to ensuring that those who are HIV positive are enrolled into care, to make sure that those who are in care are retained in care and they don't drop out, and to have good clinical outcome. We're also supporting safe male circumcision, which, as you know, is one of the prevention methods that can be used to prevent transmission of HIV from infected women to men. We are also working in the area of improving maternal health as well as newborn care in a number of districts and facilities. We are supporting the ministry and the implementing partners to integrate family planning into HIV work, because as we know, there are a number of women who could be HIV positive, but they don't want to have pregnancy until they are ready to do so. We know very well that TB is usually one of the infections that accompany HIV, and our work includes ensuring that all the HIV positive patients are screened for tuberculosis, and those who are found with tuberculosis are enrolled into care for TB as well as for HIV. And we're also working with the partners and the ministry to improve care of infants who are born to HIV positive mothers. The other areas that we are working on include working with the Ministry of Gender, Labor and Social Development to improve the care of orphans and vulnerable children who are left behind by HIV parents who have died. And in all the work that we are doing, we make sure that gender is integrated into that work, and research is one of our major items that we do to learn new things, as well as documenting the lessons that we are learning for purposes of passing on this information to other partners who would like to use that information. Thank you very much.
Thank you. Humphrey, recently you were sharing with us some of the results from your work, and some of them were very impressive. Maybe you would like to tell us about some of the accomplishments. I remember the one on the coverage and retention and wellness of patients on antiretroviral therapy, and others as well.
Yeah.
Please.
Yeah. Thank you very much. In our work, we did find that there was a big problem in patients who get started on treatment. Many of them were dropping off, they are not completing treatment. So we focused on ensuring that patients who have been started on treatment are kept on treatment. And so we have found in a number of facilities that we have managed to keep patients who are HIV positive and on treatment. We have managed to keep them in care. And we are also seeing an increasing number of patients who are getting better in terms of not getting opportunistic infections and not losing weight as a result of good care that they are receiving. We have also seen that in the maternal health programs, the number of mothers who are receiving active management of third stage of labor has increased, and as a result, we are seeing less of the bleeding as a result of the pregnancy, and we're also seeing an improvement in the outcomes of babies who are born to the mothers who are being monitored by the active management of third stage of labor.
Thank you very much, Humphrey. I would now like to turn to my colleague, our Chief of Party in Georgia, Tamar Chitasvili, who has been doing some of the most innovative and pioneering work that we have seen in low and middle income economies related to the care for patients with chronic conditions. Tamar, this is very important and very innovative work, and we're delighted that you have taken the leadership to do this, and we'd love to hear about it. So,
yes,
you would...
of course. The project has started about 18 months ago, and its key focus is improving quality, continuity and consistency of medical services both at ambulatory and hospital level for those decisions that contribute to huge mortality and disease burden in Georgia, in our country. And those diseases mostly are cardiovascular disease and its risk factors like behavioral and physiological, like tobacco use and alcohol use, hyperlipidemia, high cholesterol, high blood pressure. We also working on chronic pulmonary diseases and also pediatric respiratory infections, both at ambulatory and hospital level. So as you see, the clinical content areas we are covering is quite big, but we tried very hard to capture the needs of the big population, and by this way have the bigger impact on the quality and clinical outcomes of the population. One component of our project is to work with specifically with ambulatories and hospitals in one project-supported region. This is Emirati region of Georgia, and apply the best practices from this region to various regulatory or financing tools and support institutionalization of these best practices at the national level. And also we support at the national level access and use of evidence-based medical information by Georgian physicians. It is interesting to see that despite the fact that we are working with very little number of hospitals and ambulatories, we try to find innovative ways to expand and spread the best practices. So we open the door to any facility, whether it is ambulatory and hospital, to sign the memorandum of understanding with us and do the work by themselves using the tools that we developed, using the expertise that we provided to collaborative facilities, show their results and prove to everyone that it is possible through very minor intervention, but with very heavily sorted like technical documents and tools that developed under project support. And after like 10 months of project improvement interventions with very intensive clinical and quality improvement trainings at ambulatory and hospital facilities, within coaching, auditing and feedback and providing feedback on medical charts, we are able, and of course, as Rashad mentioned, sharing results on the best practices, what worked, what didn't work. During the regional learning sessions, we are all teach, all learn, and all contributing, starting from medical facilities to national leaders, regional leaders. We reached pretty significant improvement results at ambulatory sites from average compliance about 20%. We now reached more than 80% compliance in almost all clinical content areas. And in hospital level, from about 15% compliance with best clinical practices, we have reached about 60% of project compliance. So this is impressive results, but this is we should not stop, and we need to continue to make the system sustainable. And we do this through very close collaboration with the host country government, with Georgia Ministry of Labor, Health and Social Affairs, National Center for Disease Control and Public Health, and other institutions to integrate very high impact but cost-effective medical services into the medical health publicly funded health programs. We developed and designed national protocols in all clinical content areas that we are working with. We supported registration of continuous medical education modules in medical universities, so that after program closes, there is a possibility to teach and learn from the best practices. And we supported also development of accreditation standards in the hospital accreditation standard in project-supported clinical content areas, and developed some interventions to set the quality improvement culture and establish quality improvement culture within the Georgian facilities.
Tamar, thank you. That's wonderful. If I can turn to Nigel. Nigel, you're overseeing our largest region, the East Africa region, and you're working across multiple technical areas. I wonder, between countries and technical areas and all of that, and also the work that you're doing with in caring and improving care for orphans and vulnerable children in Malawi. Mm-hmm. How do you see things? What's what are you seeing from your 30,000-foot view of this work?
I think this comes back to what you were talking about, the importance of being able to package information, turn it into knowledge that can be used and come up with ways of spreading it is crucial. You know, as you said, I look after 10 countries which have a variety of different programs. Different governments have different priorities. So each of our programs is working on different things. And it's very interesting that sometimes some countries have solved problems that other countries haven't even started thinking about yet. And the ability of systems to spread good ideas is incredibly limited. And so the ASSIST project, I think, is a great mechanism for trying to improve that. You know, this is a mechanism that the U.S. government has set up to improve our ability to package information and to spread it, and it's a key part of our work. You know, there's a lot of talent, a lot of creativity, a lot of good ideas among people who are doing the work at the ground, but that often gets lost. You know, that information doesn't come up to policymakers very often and doesn't transfer over to other people working in other facilities or other districts. And that's one of the things that I'm most excited about. You know, and we do that on our own project. So this week, one of our staff from Uganda is in Malawi, helping them on a new technical area. One of our staff from Ethiopia is in Mozambique, doing the same. We have a phone call next week between Nigeria, Mozambique, Malawi, and Kenya, talking about different ways of measuring and supporting improvement for work with vulnerable children. So I think it's a very exciting area that I think is going to become very useful.
Thank you. This is a very exciting perspective, and I do feel that our work is going to be in different from what it used to be, with all this managing of knowledge and being able to spread in ways that we have not done before. So I'm personally very excited about it. Let me just go around and see if there are any final comments. Maybe Humphrey, if you have any final comments before we end.
Yeah, right. We are all very excited about this project, and in Uganda, the Ministry of Health is very appreciative of the support that is being provided, together with the Ministry of Gender, Labour and Social Development. And I think, as you said, the issue of country ownership, these two ministries are taking that very seriously, and we hope that by the end of the 5 years, these approaches will have been fully integrated into the government of Uganda approaches.
Mm-hmm.
Tamar, any final comments?
From my perspective, what we have seen so far is that our key approach to base our interventions and communication with key stakeholders based on evidence works very well. Because when we work together with facility teams and produce results, and these results are touchable and seeable to people, then everyone believes and moves forward. So base the evidence on the work we are doing, I think is crucial.
Well, Nigel, any?
Yeah, I think you know, the other thing that's very interesting about this project is that it has a lot of respect for helping people figure out how to do things. You know, we really know what to do in many cases. You know, most of the health issues, we know what the solution is. We know what the right treatment is. We just don't know how to do it all of the time for every patient everywhere in the world. And there's not going to be any universal solution for that. The solution is to help frontline workers, you know, make it work for themselves in their context. I think that's the heart of this project, and I think it's, you know, has huge potential. I think we've seen that from Uganda, from Georgia, and from lots of other countries.
Thank you. If I can say a couple of concluding remarks. First of all, thank you very much. I mean, these are very rich experiences, and I know that we can spend a whole day talking about each one of them, and we still wouldn't be done. But to me, there's a key point that's coming here, which is where Nigel ended. The fact that in development, as a rule, a lot is known that can save lives, that can alleviate suffering. However, arranging work in ways that make that those efficacious interventions work effectively for every patient every time is at the heart of the work that we're doing. We call it improvement. Others are calling it implementation science. I've more recently been hearing the term delivery science. It doesn't matter what we call it. It really is about acknowledging the problem, knowing that solutions do exist for the most part, and then it's the translation of these solutions in everyday work so that every patient who can benefit from them benefits from them. And of course, at the heart of it is getting the results. I mean, the results are the ones that speak for this. So one of the things that I'm most excited about is continuing to get the sort of results that we have been getting under the HCI project, and even evolving those further and getting even better results going forward under the newly awarded ASSIST project. With that, if I may bring our session to a close, I want to thank you very much. This has been a very nice conversation. I thank you for all your contributions. And I also want to take a moment to acknowledge the International Forum and the British Medical Journal for hosting us to have this conversation and to talk about the good work of the United States Agency for International Development's program in improving healthcare. Thank you.